Hi, I'm Christina Oldfield, and I'm going to go over HIV N Pep medications with you and the importance of it and why and how we give the medications. Why is this important? Our objectives are going to be identify the medications used for prophylaxis treatment for HIV, identify the time restraint on administering the medications, because there is a time restraint, verbalize the common side effects with these medications, and how follow-up is important after receiving these medications. These are just some of the objectives we're going to cover today going over the HIV N Pep. So what is the importance of knowing this? Knowing this and watching this video will increase your knowledge on what HIV is and what options you have if you are sexually assaulted. We're going to focus on the sexual assault patient that comes in and is available this opportunity to have these medications. This will increase an awareness of the indications for the medications and along with identify patients that can benefit from the medications. So like I said, we're going to focus on the sexually assaulted patient, but that does not mean that other people are not able to receive the HIV N Pep. It's mostly just focused on this today. So what is HIV? HIV is the human immunodeficiency virus. It is a lentivirus, and that causes the HIV infection. That in turn can turn to the acquired immunodeficiency syndrome, also known as AIDS. AIDS is a condition in which progressive failure of the immune system allows for life-threatening opportunistic infections and cancers to thrive. There is no cure for AIDS. Some of the statistics that we'll go over is there are 1.2 million people in the United States living with HIV. That is a lot. 21% of the infected persons are unaware of their status. So 21% of people living with HIV do not even know that they may have HIV. 50,000 new infections happen per year. So this is the United States statistics. This is not including statistics from other countries. So what is HIV N Pep? I've said it several times. You may be thinking, what does that mean? HIV N Pep are retroviral drugs that can be administered to help prevent HIV from spreading. This works by preventing HIV from making copies of itself and spreading throughout the body. So HIV N Pep is just the name that they give this regimen of medications. So if you go to a facility, if you are assaulted and you're worried about HIV transmission, if you hear the word HIV N Pep, that's just the name they give the medications to treat this disease. So why is this important? Why is HIV N Pep even important to think about? Well, think about the statistics of sexual assault. Every 107 seconds, a sexual assault occurs in the United States. There is an average of 293,000 cases each year of sexual assault. Those are what is reported. Imagine the stuff that is not reported. A lot of times males are reluctant to report because of the stigma of a male being sexually assaulted. Women are reluctant to report, especially if it's their spouse. They don't consider it sexual assault. So these are just statistics of reporting. When someone is sexually assaulted, the risk for HIV transmission is something that needs to be addressed, at least thought about. And we'll go over some of the reasons why you have an increased risk for HIV transmission if you're assaulted certain ways. On to why is this important? With these statistics, more and more patients are reporting sexual assault. The patient needs to have the training and education to seek appropriate care following an assault. Does not mean they have to report to law enforcement if you're over the age of 18. It means we're worried about the treatment and prophylaxis treatment for HIV. So systems should be established to ensure that survivors of sexual assault have universal access to medications to prevent HIV following an assault. There are many facilities where this is lacking. Many facilities do not have the appropriate standards of care in place to administer this medication, and patients are not appropriately educated on they can receive this medication. So this is why this is important. Who can benefit from HIV N Pep? Well, there's many people who can benefit from the HIV N Pep. Any person who is sexually assaulted and arrives to the hospital 72 hours post-assault. We'll go over the time restraints later in the module, but that's important to remember, 72 hours for education. Any patient that has been penetrated penile-anal. Penile to anus is increases your risk for HIV transmission, and it's the highest risk out there right now. Any patient that has multiple injuries. If you have multiple injuries, you have a higher risk of transmission because you have that open skin. If the known suspect is HIV positive, so if you know the suspect and you know that they are HIV positive, the HIV N Pep would be a good treatment prophylaxis for you. If the known suspect is a drug user, it is known that IV drug users have a higher risk of transmitting HIV. Male-to-male assault. And again, that goes to the penile-anal penetration. And if there are multiple assailants. If you have multiple assailants, you have a higher risk of transmitting HIV. So what medications do we use for this HIV N Pep we've been talking about? We have Truvada. Truvada was approved by the FDA in 2004. It's used as a part of a complete prevention strategy to reduce the risk of HIV infection who are at high risk. Riteglivir was approved by the FDA in 2007. This is used to treat HIV infection, and they're used in conjunction with each other. So you will get Truvada and Riteglivir, both. Just very important that you note, neither of these medications cure HIV or AIDS. These are just for prophylaxis treatment. If you are positive for HIV or AIDS, you cannot receive the HIV N Pep because it does not work to cure AIDS or HIV. This helps reduce the transmission of HIV and AIDS. Talking about. This medication must be administered within 72 hours. That means if you come in 73 hours after you were assaulted, you cannot receive the HIV N Pep medications. It is a strict 72-hour limit. So, education on getting to the hospital and getting treatment is very important. Getting there before your 72 hours is up. 72 hours is strict. It is known to be ineffective if we administer the medication 74 hours later, 73 hours later. Now I have the question of, what if you have a patient, or what if you don't know when you were assaulted? Well, if you don't know, then it's a judgment call. We see the last time that you were conscious, how long ago was that, and it's right on the verge of 72, 73 hours. We would stem on giving it because it won't hurt you. It just won't be effective if it's past the 72-hour mark. Some of the common side effects of HIV N Pep. We have diarrhea, nausea, insomnia, fatigue, headache, dizziness, and skin rash. These are not limited to these side effects. These are just some of the common ones. Some other side effects could be chest pain, other indications of side effects could be vomiting. So just so you know, these are not limited to these side effects, but these are just some of the common ones that patients have reported with these medications. Something that could be kept in the back of your mind is if you come in and get the HIV N Pep medications and you're worried about diarrhea or nausea, Imodium or Zofran can be administered by a physician and a script can be given. The patients will be given a 3 to 7 day supply of medications before they leave the hospital. To follow up with infectious disease, the patient must adhere to a 28-day regimen of medications. This includes a follow-up with the infectious disease doctor. The importance of follow-up must be verbalized to the patient. It is very, very important that everybody follows up with the infectious disease doctor. That's where you'll get the results of your labs that we're drawing. That's where you'll get the rest of your medications and your prescriptions. That's where you get the rest of your treatment. And we go over an infectious disease doctor that you can see, and that way you are prepared and you don't have to go searching for one. So what are some of the key points that we went over today? HIV N Pep should be available and patients should be educated on the medications available. There is a strict time constraint on giving these medications. Remember, 72 hours. This is a 28-day regimen and strict adherence is important. Education with the patient will alleviate fears of the medications. There are some fears with these medications, but with education on the medications and the indications for the medications, the fears can be alleviated. I have a short quiz just to make sure that you have gained knowledge in this. You were sexually assaulted 73 hours ago. You can receive the HIV N Pep medications. True or false? False. 72 hours is the key. You must be reported to the hospital within 72 hours to receive HIV N Pep medication. There are 1.2 million people in the United States living with HIV. True or false? Remember, 21% are unaware of their status, and 50,000 new infections each year are reported. The two medications administered for HIV prophylaxis are Truvada and Reticulavir, Sestiva and Aprivus, Norvir and Fuson, or none of the above. Great. Truvada and Reticulavir. Those are the two medications that we administer for HIV and PEP, and they have to be used together in conjunction with each other. Some of the side effects of the medications administered are A, nausea, B, diarrhea, C, skin rash, or D, all of the above. All of the above. Very good. Now remember, those side effects are not limited to those, but those are some of the most common side effects that we have reported from patients. Here are some of my references I have used. I hope you found this to be very educational, and knowledge about the HIV N Pep is very important. Like I said, having the education, the patients, and the staff to administer these medications and to seek out these medications is very important. Any questions? Thank you for listening to my PowerPoint. Have a great day.